South Africa is entering the second wave of COVID-19 infections. That's the latest announcement coming through from the Health Minister, Dr. Zweli Mkhize. We're joined by Professor Koleka Mlisana, who is the Executive Manager and Academic Affairs, Research and Quality Assurance at the National Health Laboratory Service. Good evening, and thank you so much for your time tonight, Prof. Firstly, let's just begin with this news that the Minister has confirmed that we are well indeed into the second wave of COVID-19 in the country. What does that actually mean when it comes to our management of this virus? Are we going to have to go to where we were in June and July as the risk to lives and livelihoods becomes more pronounced?
Thank you, Cathy. Good evening to all the listeners. Actually, what the minister just announced is the reality that I feel each and every South African has just got to grapple with and understand that we all have got a responsibility to play. Now, the issue is that, as he has already mentioned, we are seeing a significant increase in numbers. Now, how far are these numbers going to increase? Truly speaking, it really is going to be dependent on how we respond as South Africans. Because remember, the virus, if we stick to the non-pharmaceutical interventions, which everybody keeps talking about, social distancing, ensuring you've got your mask, you're washing your hands, you sanitize. If we stick to that, then the impact of this wave is not going to be that severe. But if we continue to behave as we have been as a country, then when we look at other countries, when they had the resurgence, they actually had cases that were even much more than the first wave. And so for me, it would be to say, really, whilst the Department of Health and everybody else, they're trying their means to make sure that we contain the spread, it really is going to depend on us as South Africans, how much we adhere to what we have to do. As to, trying to anticipate what numbers we're going to look at, if we're all to listen to what is being said and do it, then we won't see, the numbers will not be as high as we're all praying that they don't get to levels that high that we can't manage and that the health system just completely succumbs. So I'm really hoping we're not going to get to that.
Professor Mlisana, the first time round that we saw this increase and, the appeals, of course, were made, government didn't leave it to chance. So the minute they saw that we were entering a danger zone, harsh restrictions were put in place in order to get people to comply. Is that going to be the only way out of the situation? Because the reality is we've had a couple of months now to almost manage our individual response to COVID-19, and suddenly we seem to have become much more lax than we were before.
It's a very difficult situation, Cathy, because, as we say, as the minister, even the president continues to say, that really we have got to take the responsibility. Now, the challenge, that we're facing now is that when COVID came into the country for the first time, we were able to have a complete lockdown. And the question now is, that is unlikely to be the answer because, we're getting into Christmas and we're getting into time with family, and therefore that is not likely to happen. And even if it were to happen, it would have to be done to a limited extent. And so you find that at the end of the day, remember what the government or what the health department can do is to actually manage whoever gets to be infected. But the main and critical point is that we need to control the infections. And I think for as long as we continue to speak and we continue to actually monitor and police ourselves, I think as South Africans, we truly need to bring this back to us because there's a limit to what government can do and actually enforce certain restrictions. But the bulk of it really, and the biggest concern is the fact that we're getting into the festive season. And so everybody's concerned, how do you clamp down a festive season? And we know that there actually continue to be South Africans who still want to pretend that COVID is not existing. And really, I think for me, the onus is going to get back to us as citizens.
You know, the partying and the festive season, at least in that sense, is one of the issues that South Africans need to take responsibility for. On the other hand, we also know that we're entering a time where travel, interprovincial travel, is almost inevitable. We're going to see people move from Gauteng to Limpopo, to the Western Cape, to the Eastern Cape. So you're going to have people that are going to be in those hotspots right now of COVID-19. Do you foresee a situation where interprovincial travel has some level of restrictions to it?
Right now, my first, even before, the politicians say so, my first plea to the country would be, let's individually restrict travel. I mean, we can see that there is, a lot of infections in the Eastern Cape, in the Western Cape. And so let's take the responsibility and do less travel. Second to that, whatever restrictions that can be put in place, I think government is really trying the best that they can. And even the health care, I mean, the health department, in that if you're looking, for instance, in preparation for this, we have increased the testing strategy that is, that's available. And as the minister mentioned, that right now we're no longer just doing the PCR like we were for a long time, but we also have got a rapid antigen test, which can tell you on the spot whether you are positive or not, which obviously is going to come in very handy. And so when we're looking at restrictions for travel and where we put in stops and say you need to be tested before you can, if we decide to go that route, there are also even better testing mechanisms. And I think even for the hospitals themselves, I mean, the access to oxygen, everybody is trying to make sure that that is increased and making sure that whatever, all the patients that are coming in and end up being admitted are going to be managed, because we have learned a lot of lessons, from the first wave. So all these are going to be happening. But I think at the end of the day, when we're talking travel, we need to be responsible as South Africans and say, maybe this is one time, I don't need to see family. I know it has been a very difficult year, but that's going to cause each and every family to decide, how are we going to do this? And even if you do go home, for that matter, then how do you behave when you are with family? And how do you make sure that as a unit, as a family, you social distance? Maybe we need to look at family distancing, where if you are at home, just remain at home with your family and stop having the parties, stop having, weddings and funerals be restricted as they're supposed to be. So really, for me, there's a lot of effort that's going to come to us as individual, citizens, whilst government is doing its best to restrict as much as they can.
Of course, one of the biggest dangers of the migration this time around is that when you look at a province like the Eastern Cape, and even the Western Cape for that matter, we're already told that some of their hospitals, especially in the regions that have been worst affected, are already full. The ICU beds are full. So when you have an even greater population to have to cater to, how much more difficult does that make the process? And are we looking at a situation where Gauteng will have to take some of its resources? Traditionally, we know Gauteng becomes very quiet over the festive season. Are they going to have to send some of their resources out to other provinces? The logistics of trying to deal with it just seem to be that much more complex.
I can't, agree more with you, Cathy. You are spot on. Because, I mean, as we all know, I mean, in Gauteng, during Christmas, it's completely quiet. And so the question is, but just even thinking about the logistics thereof, even if the province would be willing to actually make sure that they can make provision and allow for some of the resources, just the logistics of ensuring that that happens. Because remember, we're talking in 2 weeks' time, basically. So we really just don't have enough time. And you are correct to say right now, when we look and we're hearing the reports in the Eastern Cape, the healthcare system is already under a huge restraint. And now to be flooded by people who are going home, it really is just going to cause havoc. And so that's why it really, whilst we are easing out the challenges within this, the way to ease the challenges in the Eastern Cape is going to be for people to take the responsible decisions and stay away from those areas. I mean, you look at what's happening in Nelson Mandela Bay right now. People will tell you that there's no There's absolutely no beds in hospitals. And so it really is serious. And for us to hope and pray that there will be enough time and enough logistics for Gauteng, for instance, to make those resources available. What are we talking about? Surely they can't move their hospitals. Yes, maybe they might, but I mean, even if we were to say there can be extra healthcare workers who are, who can go and assist in the Eastern Cape or in the Western Cape, we just haven't got time to do that, unfortunately.
From a testing perspective, Professor Mlisana, as things stand right now, how many tests need to be performed on a daily basis to at least get a good picture of just how widespread COVID-19 is in the country? Because we know that the testing rates have changed and they vary quite significantly depending on where you are in the country.
Well, really, when we look at what has been happening, we are looking at saying we should have at least, more than 300 tests per 100,000 population. And you find that we have managed to reach this in the Eastern Cape and in the Western Cape as well. But for other, provinces, we're not testing as much as we would like to. And so that's the other message we need to send, that we really need to ensure that we do, there's more testing, because remember, for us to identify those that are infected, they need to be tested. Now, the advantage, and if you're looking at the capacity in the country, within the first, surge of the pandemic, we're able to create reasonable and actually probably enough capacity to be able to test within the country. But you're finding that we still haven't reached full capacity as yet. So there's a lot of leeway for more testing to happen. And the advantage, like I said earlier on, is that it's no longer just the long turnaround time PCR test that we're doing. Right now, we have also got the antigen test. And I mean, if you're looking at what NHLS has done as well, we are making sure that we've got enough assays to actually cover as much testing as possible, as the possible demand over this festive season. And the advantage there is that it's a rapid test. You get your results within 20 to 30 minutes. And that's going to be the way to go. So we really need to ensure that we do as much testing as we possibly can. And the advantage of the rapid test is that once you have your results, if you're positive, that's definite. So for you, we can streamline and say you need to isolate. And if you're negative, then we say you're fine. But really, there's been a lot of improvement, first at capacity level and even the spectrum of tests that we're using at the moment.
All right, let's leave it there for tonight. Professor Koleka Mlisana, she is with the National Health Laboratory Service. Let me thank you so much for your time on the channel this evening.